Today's episode is sponsored by Airflow breast pumps. Did you know that your health insurance will cover the cost of a breast pump? It is true, guys, I promise. In fact, many health insurance plans also cover milk storage bags, breastfeeding prep courses, and more. At Airflow breast pumps, you can shop top-rated breast pumps from brands like Medela, Spectra, and Motif without ever opening your wallet. Fill out their quick and easy insurance eligibility form, and they'll take care of the rest. It might just be the easiest thing that you do during your whole pregnancy. Just visit airflowbreastpumps.com/mommy labor nurse. That's AEROFLOW breastpumps.com/mommy labor nurse to find out why more than 1 million moms have chosen Airflow breast pumps to get their pump through insurance. You're listening to the Mommy Labor Nurse podcast, where you'll gain the tools, knowledge, and confidence you need to erase the unknowns, feel in control, and have an even better birth, no matter how you deliver. My name is Liesl Teen, mom of 2, practicing labor and delivery nurse, and your host. From over 8 years and counting of working at the bedside, I know that knowledge is the key to an even better birth. So tune in each week to learn about all things pregnancy, birth, and postpartum from me, a labor and delivery nurse that's seen it all. And now let's get into this week's episode. This week on the Mommy Labor Nurse podcast, we are talking all about newborn reflexes. Yeah, did you know that when your baby is born, they come into this world with 6 distinct reflexes? They're pretty cool. And if you've got a newborn at home, you've probably already witnessed them without even knowing it. So we're going to get into it and you're probably going to be like, oh, wait a second. Yeah, my baby does that. For example, have you ever tickled the sole of your newborn's foot and watched their toes curl? Or maybe you brush their cheek with your finger, intentional or unintentional, and they instantly opened up their mouth. Those are newborn reflexes. These little actions are pretty adorable to watch, especially as a mama, but did you know that there's actually a purpose for them? And today we are going to learn all about this fascinating topic. After this episode 2, keep up the newborn education by listening to episode 169, 10 Surprisingly Common Newborn Behaviors with my friend Dr. Mona Amin. But now let's talk reflexes. What even are reflexes in the first place? So, newborn reflexes are just involuntary movements that your baby is born with. They occur as responses to different stimuli and ultimately exist to help them survive the first few days, weeks, and months of life. They are exactly the same types of reflexes that we have as adult, right? You know what a reflex is if you go to the doctor and they take their little hammer and they hit underneath your kneecap to make your foot, kick. That's a reflex that we have as adults. And these newborn reflexes that I'm getting ready to talk about, it's the exact same thing. When you go to the pediatrician, you should notice that your pediatrician is making sure each one of these reflexes is present, if age appropriate, because some of them go away. We'll go over them, but some of them, all of them essentially go away at some point. But if age appropriate, your pediatrician should be checking for these reflexes at each of your appointments. And it's important for these to be assessed by your pediatrician to ensure that baby is properly developing, right? Yes. We are going to be talking about 6 different ones today that should be present at birth. And as I mentioned previously, each one of these reflexes acts in a different way to protect your baby from certain stimuli and help them survive in this crazy world. It's pretty cool, actually. It's not just, your baby does these things for no reason at all. No, it's actually evolutionary. They're doing these things to help them survive. The first one is called the rooting reflex, and I think you can probably guess what that one is. A lot of people have heard of this one, but it just happens when baby turns their head and opens their mouth in response to something touching or brushing up against their cheek. And this particular reflex exists to help baby locate your nipple in preparation to breastfeed. Yeah, it's present at birth, and the rooting reflex is typically present for the first 4 months of baby's life. It doesn't have to be present, after breastfeeding is established, right? But for those first couple months, yeah, it's present to encourage baby to turn their head and feed. And typically, the rooting reflex actually doesn't develop in utero until about 28 to 30 weeks. And this means that a baby born prior to this gestational age may actually not have developed their rooting reflex yet because, yeah, some babies are born before 28 weeks for sure. So that's pretty wild to see that a little preemie baby that is born, not in utero anymore, just not have this rooting reflex yet because they're not old enough. So in this particular case, or even with full-term babies that don't quite have a strong suck, because some babies don't, moms might need to hand express milk onto their nipple to guide them to the breast. In the case of preemie babies, it's a little bit different, basically impossible to nurse a less than 28 weeker. But essentially, we're doing things to try and encourage that rooting reflex to start to develop.
Do you want to know what's frustrating? Baby PJs with snaps. Why is that even a thing? Why did someone think, I'm going to put a billion snaps on these PJs that a mom or dad has to undo and then redo in the middle of the night when they change their baby's diaper. That is the way that I'm going to make these PJs. All seriousness though, not a fan of the snaps on the PJs. And that's why I'm so excited to tell you about this week's sponsor, Simply Magnetic Me. Simply Magnetic Me was created by two parents who are on a mission to make parenting and dressing easier, something I think we can all get on board with. Simply Magnetic Me offers organic cotton essentials with innovative magnetic fasteners that make changing baby practically effortless. You may have heard of Magnetic Me, and Simply is their new sister brand that offers the same beloved magnetic closures at a more affordable price. You can create a custom bundle on their website, combining the prints, styles, and sizes that you want with outfits as low as $15. The more outfits that are in your cart, the more you save. And trust me, babies need a lot of outfits. Simply Magnetic Me also believes making good decisions for your baby means making good decisions for the planet, which is why their outfits are made with GOTS certified 100% organic cotton. The fabric is made without toxic dyes, pesticides, or harsh chemicals. It's as safe as it is gentle on baby skin. Say no to snaps and head on over to simplymagneticme.com to stock up on no fuss essentials and use the code MLN20 for 20% off your first order.
The second reflex is the sucking reflex, which is kind of in the same area, right? And this is such an important one for babies, obviously. I mean, all of the reflexes are important, but this one is especially important, right? Because it helps them know how to eat. I think it's pretty cool. Like, just think about it for a second. Your baby is born instinctively knowing how to suck something so they can eat and ultimately survive. I don't know. That just blows my mind. Like, it's wild that they know to do that. So this reflex isn't fully developed until baby is about 36 weeks gestation. And this is why a good number of babies born prior to this mark have some difficulties with latching, feeding, and weight gain, because an underdeveloped suck reflex makes it difficult for them to ingest breast milk or formula orally. So many of them require just some kind of intravenous nutrition or tube feeds until their suck reflex gets a little bit more mature. Now, with a fully developed and mature suck reflex, babies should start to suck when the roof of their mouth is touched. Okay, that's actually the thing that sets off the reflex. It's the touch of the roof of their mouth. So you should notice this with the nipple of a breast, the nipple of a bottle, a pacifier, or your finger. And even with a mature suck reflex, it can take baby a little bit to get the hang of things after they are born. So obviously, breastfeeding is a learning curve for both of you guys. So make sure you give yourself grace and patience. And I am just going to go off the cusp here and say that I have said reflux about 5 times as I've been recording this podcast episode. So if you hear me say reflux, know that I mean reflex. We're not talking about reflux, acid reflux at all in this podcast. It's just because it's almost 10 o'clock at night and I'm just tired and I'm running over my my words. And I just have been saying reflux instead of reflex. So if you hear me say that, that's why. Anyways, so the sucking reflex, which is present at birth, at least of a 36-week baby, doesn't ever really go away. So instead of disappearing, the suck reflex actually turns into more of a voluntary behavior at around 2 to 4 months of age. Isn't that cool? So yeah, something touches the roof of their mouth and then they voluntarily decide if they're going to suck. Number 3 is the Moro reflex. This one is cool. So this is also known as the startle reflex. And this one occurs when baby suddenly throws their arms out like, whoa, okay. And then they pull them back in as if they just really got startled. And this reflex is a protective response to sudden movements or loud noises. It typically peaks during the first month of life, okay? It starts to disappear around the 2-month mark, and it should be present and equal on both sides of your baby's body. So that's something that your pediatrician is going to be looking for some reason. If the Moro reflex is like more present on the left side versus the right side, that could mean there's something developmentally, neurologically going on with baby that needs further investigation. And like I said, they are going to be checking this at each appointment. But for some reason, if you notice that, wait a second, I think my baby only has the Moro reflex only on this one side, be sure to bring that up to your pediatrician so they can really check it out. And one thing really noteworthy about this reflex is that it really can impede sleep for some babies. Absolutely. Just think about it. If you are fast asleep and all of a sudden, bam, okay, and your arms like unexpectedly go flying up in the air, that is enough to wake you up, right? If you just you have no control over your arms, they just go, that can totally wake you up. And that's a lot of times what happens. So guess what really, really helps this? A baby swaddle. So a swaddle can really, really, really do wonders to help calm this reflex and keep baby from waking themselves up from this little Moro reflex that's really cute, but it can really disrupt their sleep sometimes. All right, the sound of that heartbeat means it's time for this week's segment of Birth It Up Babies. This one says, I've been meaning to leave this review for a while. I bought the Birth It Up Epidural Edition, and what a godsend. I gave birth in November 2022, and I was prepared for everything. Yay! My epidural dislodged at 5 centimeters. Yikes. And man, I was in a load of pain, I bet. But I remembered the tips from the course and relaxed and breathed through each contraction. I was even prepared for an emergency C-section because I was almost headed in that direction. Thankfully, I gave birth vaginally. The course contains C-section and unmedicated birth info though too. They truly cover every scenario. Thank you so much. If you want to have an even better birth, just like this mama, head on over to mommylabornurse.com/courses to learn more about our 3 online on-demand birth classes. Number 4 is the tonic neck reflex, aka the fencing reflex. Okay, this one's also pretty cool. So this occurs when your baby extends their arm and leg on one side while flexing the opposite arm and leg. It's kind of like a fencer stance, hence the name. So this reflex helps babies develop their hand-eye coordination and overall body awareness. Isn't that wild? At a newborn, they're starting to learn that they have a body. Newborn development and just all of this stuff, I don't know, it just fascinates me. So this particular reflex is pretty subtle and it might not even be exhibited if baby is crying or upset. but it is present at birth, and it typically goes away somewhere between 5 and 7 months of age. So similar to that Moro reflex that we just talked about, the tonic neck reflex should also be present and equal on both sides of baby's body. And this one is a bit more subtle, so it doesn't go off per se as easily as that Moro reflex. So it might be a little bit harder to pick up on. But like I said, with the Moro reflex, if you have any potential concerns with this one or any of the other newborn reflexes that we've talked about or we're going to talk about, for that matter, certainly don't hesitate to bring it up with your pediatrician, of course. Number 5 is the grasp reflex. So if you have a little newborn, maybe you're listening to this podcast, you're holding your little baby in your arms. So let's do a little experiment for those of you who are listening who have little baby newborns in their arms, because I'm sure there are some of you out there, right? If you stroke your baby's palm with one of your fingers, see what they do. What do? Do they grasp your finger? They should. Your baby should immediately start to close his or her fingers like they are attempting to grasp your finger. So the same actually holds true too if you stroke the bottom of their foot. They're not going to try and grasp your finger with their foot, but they should actually curl their toes in response. It's the same thing. It's called the Babinski reflex, but it's the same thought process. This happens for the same reason. So this reflex also helps baby develop their hand-eye coordination and their motor skills, and it's present from birth, and it disappears anywhere from 5 months to about 12 months of age. It stays around for a little while. And fun fact, I'm about to read you a little excerpt from a Wikipedia about the evolutionary significance of this reflex, because I think it's pretty cool. I remember learning about this in biology, I think in like 11th grade, I don't know. But this reflex is really cool because it's significantly more frequent in infants of fur-carrying primate species. So it's theorized that this grasping reflex evolved because it's essential to survive in certain species, usually primates, where babies are carried in the fur, right? You've seen like little baby monkeys, little baby gorillas, they all kind of just cling on to their mommies by grasping, kind of the front of their chest, of their fur. And per Wikipedia, the infant's ability to grasp onto a mother's fur allows the mother to keep the infant with her while foraging for food or moving from place to place. That makes so much sense, right? Because she doesn't have to use one of her arms to hold her baby. Her baby can just kind of cling on to her. I just thought that was a cool little fact to throw in there. All right, so number 6 is the stepping reflex. This one's also pretty cool. So this is when baby will move their legs in a little stepping motion when they are held upright with their feet touching a flat surface. And if you couldn't guess, this reflex helps babies develop the ability to walk. Yeah, even like as a newborn, they are starting to, some kind of wires are crossing and making connections that, hey, at some point in my life, I'm going to have to walk. And P.S., have you ever heard of the breast crawl? A lot of people have. I'm not going to, no judgment if you haven't. I'm pretty sure I've brought it up at some point on the podcast, but the breast crawl is also pretty cool. So some babies, when they are placed on your chest right after birth, will actually crawl instinctively towards their breast in an attempt to initiate breastfeeding. And this crawling is possible thanks to this stepping reflex. So wild. And this reflex, which is present at birth, like I said, will disappear around 2 months of age. It actually reappears towards the end of baby's first year of life as they begin to learn how to walk. How freaking neat. So overall, newborn reflexes are important for baby survival and development. And while most of these reflexes disappear, right, as baby grows older, they help lay that foundation for their physical and cognitive development in the early stages of life. Wow. And now it is time for the part of the episode where Liesl goes down a rabbit hole researching about some of these different reflexes, because I've been recording and it was just kind of a short episode. So I was like, I kind of want to do something at the end. So remember I said I went on Wikipedia when I was talking about the grasp reflex, right? Well, I just went on Wikipedia for the Moro reflex, and apparently it was named after this guy named Ernest Moro, okay? let's see, born in 1874, and he's Austrian, and he was a professor of pediatrics. And apparently, it says he elicited the moral reflex by slapping the pillow on both sides of the infant's head. That, don't do that, right? But also back then, they did some crazy things. But the crazier thing is I clicked on his name. So I went on his little Wikipedia page, and there's this whole little section called Professor Moro's Carrot Soup. Okay, I'm just going to read it to you because I didn't realize I was going to come across this. So, in 1908, diarrhea killed many babies in Germany. Who knew? Professor Moro, at the time, the head of a children's hospital in Heidelberg, which, fun fact, my family is from Heidelberg. Yeah, I'm German. My family on my dad's side is from Heidelberg. Okay, side note. Anyways, head of a children's hospital in Heidelberg found out by experiment that a simple carrot soup decreased the death rate of babies suffering from diarrhea by nearly 50%. What? It does say citation needed next to it, so I can't quite say 155% this is true, right? Because there's no citation to click on. But okay. The soup was made by pureeing 500 grams of peeled carrots in a blender, adding 1 liter of water, and then cooking it for 1 hour. After cooking, 3 grams of salt were added, along with enough water until the soup pot contained a total of 1 liter of liquid. Okay. A German study published in 2002, now we're going way forward, in 2002, outlines that acidic, I don't know how to say this word, oligosaccharides, I think that's how you say it, I don't know. Oligosaccharides formed in aqueous extracts from carrots, aka carrot soup, may lead to less adherence of bacterial agents to the mucosal wall of the bowel, thus being a more effective treatment for acute gastrointestinal infections of children than glucose electrolyte solution oral rehydration, like Pedialyte. And then it says, in 2009, experiments showed that Professor Moro's carrot soup can treat diarrhea caused by antibiotic-resistant bacteria. What? Okay, I'm not telling you to drink carrot soup instead of Pedialyte if you have diarrhea, but I don't know, maybe. This is kind of cool. Anyways, to summarize this episode, we talked about some newborn reflexes. We talked about 6 different ones. The rooting reflex, which is where a baby turns their head if you stroke their cheek, right? And then we talked about the sucking reflex, which is where they instinctively suck if you touch the roof of their mouth. The Moro reflex, which aka is a startle reflex, and it's where they throw their arms up if they hear a loud noise or they have like a sudden movement. And then we talked about the tonic neck reflex, which is that fencing reflex. We talked about the grasp reflex, which is where they are supposed to grab if you touch the palm of their hand. And then we talked about the stepping reflex, which is where they do a little step if you hold them upright and place both feet flat on the ground. And then we wrapped up with some fun facts about carrot soup. Next week on the Mommy Labor Nurse podcast, we are going to be talking about tips to keep your pregnancy a secret in the first trimester. So if you're a first trimester mama, or if you're, planning to get pregnant, or if you know somebody who's planning to get pregnant, make sure you tune in. We're going to be talking about some secret things. So stay tuned. I'll see you guys next week.
Already feeling a little more confident about pregnancy, birth, and newborn life? Don't forget to hit that subscribe button so you can continue to erase the unknowns and never miss an episode. And if you're looking for even more, Instagram is definitely where I hang out the most. Come join our community of more than 500,000 moms for birth education, tips, and solidarity. You can find me at mommy.labornurse. Check out today's show notes and a searchable library of every Mommy Labor Nurse podcast episode at mommylabornurse.com/podcast. And while you're there, be sure to head to the blog to learn about our online birth classes too. See you next week, and remember, you can have an even better birth no matter how you deliver.